ACL is one of the most commonly injured ligaments of the knee. Majority of sports injury are actually non-contact injuries. The ligament fail in a position referred to as position of no return. It happens more commonly among female athletes. Hi, I'm Dr. Edwin, orthopedic and trauma surgeon. Walk with me on a journey to recovery. It depends on the severity of injury. Sometimes ligament can be injured either as a sprain, a partial tear, or a complete tear. Minor injuries heal with time and bracing. Even minor injuries require medical attention, as injuries can take up to 6 weeks to recover. If we provide the ligament with an optimal environment during the healing process, the resulting function is often good enough for future sports. However, if during the period of recovery, we don't protect the injured ligament, it may heal in an elongated position and lose the tension it was supposed to provide. On the other hand, complete tear of the ACL almost always requires surgery if we want to return to an active lifestyle. The only exception are the patients who are very sedentary, old patients who have severe osteoarthritis, or very ill or high-risk patients who are not fit for surgery. When an ACL is completely torn, although the body attempts to heal, there will not be end-to-end healing of the ligaments as they are now far apart. Oftentimes, healing is difficult in the joint because the joint is filled with water, causing the healing factors and the blood clot to be diluted. With an intact ACL, it prevents the tibia from moving anteriorly. But when the ACL is ruptured, the tibia is allowed to move forward, and this causes instability. In cases of a complete tear, a ligament reconstruction is necessary. Reconstruction means we use a tendon graft to replace the torn ligament. And through a period of rehabilitation, that tendon graft will undergo ligamentization and become a new ACL in the injured knee. We cannot repair the ligament using end-to-end repair because the functional outcome is not good. However, we can choose to augment the ligament with synthetic material in selected cases. In most operated cases, the initial recovery period involves immobilization of the knee with a functional brace. The range of motion is gradually increased. Muscle stimulation is started as early as day 1 after surgery. Ambulation and mobility exercises are initiated before the patient is allowed to go home. Subsequent rehabilitation focuses on improving range of motion and maintaining a good muscle strength. Bearing in mind that rehabilitation is a long process and most times patients lose a lot of muscle strength through neglect. Depending on the rehabilitation protocol that we choose for the patient, return to sports can be targeted within 6 to 9 months of recovery.